My name is Hiro Kawashima, the CEO of Prescience Health and your host of the Prescience Health audio blog series. We'll be inviting a variety of subject matter experts to weigh in on topics ranging from AI applications in healthcare to trends in nursing. This week, our guest is Mary Jim Montgomery. Mary Jim is a lifelong nurse with extensive experience in nursing and operating leadership. She served as the Vice President of Clinical Patient Care Services at Baptist Health System, Chief Operating Officer at Bay Medical Center, Chief Operating and Nursing Officer at Crisp Regional Hospital, and most recently, the Vice President of Patient Care Services at Sacred Heart Health System on the Gulf. Mary Jim, welcome to our audio blog.
Thank you. I'm happy to be here.
So Mary Jim, take us through your career from your nursing education to then becoming an operating and nursing executive.
That's an interesting landscape. I started working for my father in his office as a teenager, learning the nuances of nursing, and from there had an opportunity to attend the University of Alabama, in which I received my Bachelor of Science degree in nursing. And from there, I actually started nursing and moved up through some leadership ranks to chief nursing officer. And at that time, I realized I needed to return to school and was seeking a degree in business. And the purpose for doing that was to be able to have a seat at the table with the board members and to be able to explain nursing in a manner that would relate both to the patient care and also the business side of healthcare.
Got it. And you're one of those, I think, few nurses that have made that transition to the leadership roles. As you know, with CNOs and senior VPs of clinical care, they're few and far between. So how, if any, has your perspective on nursing changed as you transition from working directly with patients into these leadership roles?
Well, I think it was really important to realize that you have to blend both the business of healthcare and the compassion and the patient care aspects of it. So I had the opportunity to really influence not only one patient by taking this road, but also influencing the care given to nurses. So in a sense, I felt like I became the nurse that cared for the nurses. And with my degree, both in nursing and business, I was able to communicate in a way that would help the nurses understand both sides of the business. And I think it better prepared them for the environment that we've been through since with all the changes in healthcare and how we have to run more as a business and not just an institution.
Yeah, that's a great point, Mary Jim. I think a lot of hospitals always talk about the double bottom line, patient outcomes as well as the actual business outcomes. So when it comes to patient outcomes, what role does optimal unit coverage play either in elevating these types of outcomes or potentially contributing to consequences in these outcomes?
Well, I think it plays a key role. One, you've got to have the right staff, the right culture, and the right resources to provide good patient care. And so one of my early focuses in my career was having the right leadership to set in place a culture that allows nurses and patient care providers to do the best job that they can do. So setting that culture, defining what that looks like and expectations, hiring the right staff that meet and want to achieve those expectations, and then working with them to identify what the resources they need, whether it's the staffing hours, the staffing equipment, all the staffing patterns that might go with that. All those are key to ensuring that you get the right outcome. So it's not just one thing that'll make you have a successful, because you've got to focus on the patient satisfaction, the nurse satisfaction, and the quality of care that you're rendering.
Yeah, that certainly is important. You just mentioned nurse satisfaction. As you know, nursing burnout and nursing retention is a critical issue now in our healthcare system. So a similar question, what role does optimal unit coverage play when it comes to nurse job satisfaction and retention?
Well, key to nurse satisfaction is feeling like they can do a good job. Everybody wants to do a good job, and at the end of the day, you want to go home and feel like that you've made a difference. That's why nurses go into nursing and healthcare, is to make a difference and to be there for the patients that they serve. And without having the optimal resources and time and energy to put toward taking care of their patients, they often go home feeling dissatisfied and frustrated at the end of the day. And we know that when they go home in that frame of mind, that's when they consider other opportunities. And it's such a competitive market for nursing and quality nurses to build to meet their expectations, that this is just paramount into doing the right thing and ensuring that you've got the right staff to take it to that next level and provide that patient care excellence.
Yeah, no, I think that certainly is spot on. So what challenges do hospitals face today when trying to achieve optimal unit coverage? Clearly, it's still an issue across the industry. Why do you think that it's such a problem?
Well, I think it's recruitment's a problem. We always have, particularly in rural areas, you're going to have shortages of nursing. You're going to have a very competitive market. Nurses come out of school, and a lot of times they want to go into specialty departments, and so med-surg areas where is your bread and butter, your core business, often is left with minimum staffing or staffing that's difficult to fill those positions. And so I think you've got to have recruitment. You've got to have a culture. We still struggle with dealing with change and communications and having the leadership in place that will support nurses to do the right thing and to be in the right place at the right time. So we have a lot of changes going on right now with meeting our quality standards. And, years ago, everybody practiced nursing and patient care the way they wanted to. And now we have research that tells us what's best practice and how we need to approach certain diseases. And that's a challenge because nurses, they feel somewhat like their independence has been challenged. Mm-hmm. And so it's a conundrum of how to deal with both sides of the equation when you're working with nurses in this area.
Yeah, I think that's totally a challenge today that wasn't faced several years back. So I guess my final question would be, as an operational executive, you've really had to look at things like staffing plans and ensuring that you both had the right number of people, and the right culture to serve the patients. When it comes to having and planning for the right number of people, what role does forecasting or really mathematical science play into that?
Well, I think it's critical because the healthcare landscape is changing constantly, whether it's due to changing market forces, physician practices, moving from one hospital to another or one setting to another. There's just a lot of changes that are going on that you can't be stagnant in the way that you're thinking. And forecasting really helps that you're able to inject those variables into the future, into budgeting. And so you have to know what those changes are. Sometimes it requires meeting with the nurses and having focus groups to see what the changes are. Even how the practice has changed for treating certain diseases and the expectations that we have to meet the quality or the bundles, so to speak, that we have to deal with. So all those things taken into account can make a difference on how we staff or how we need to staff to get the correct outcome and the most desired outcome.
Well, great. This has been very, very insightful, Mary Jim. Thank you for joining us on our audio blog.
Well, I appreciate the opportunity and look forward to being able to share any wisdom that I have with your audience.
All right. Thanks a lot, Mary Jim.